Hi guys, Luke Kane here, founder of MTP Health, creator of the knee program. Terminal knee extension, it's not the catchiest name, but it's an exercise that's super important for knee pain generally. Pretty much everybody that comes in with knee pain has been told by a physio, by the doctor, by somebody to activate your VMO, to switch on the teardrop portion of your thigh muscle right down on the inside portion above your kneecap. It tends to go to sleep, to just be a little lazy when there's any pain around. And so then what happens is the stresses shift a bit more laterally, the outside portion of your quad starts to do more work, and it creates an imbalance in the control around your kneecap. This is a real problem for long-standing knee pain, particularly OA, osteoarthritis, because by avoiding loading up your knee too much and avoiding stairs or jumping or running or loading, you tend to get weaker and weaker and weaker. And one of the side effects of that muscle switching off is you lose the ability to fully straighten out your knee. So what we lose is what's called the screw home mechanism. At the very end of the straightening of your knee, there's this little lock-in twist. Really small, you don't really feel it, but it's what makes it feel solid and straight, fully locked out. And you lose that a little bit, and then you lose a little bit of tension and muscular activation around the thigh. So the exercise of the terminal knee extension exercise is designed to switch on the muscles at the terminal, or the last piece of straightening. So it's not a big motion, it's only a small squeeze, relax, to really switch on the muscles in that part of the movement that we tend to lose when there's long-term knee pain present. We're going to run through the terminal knee extension exercise now. Now there's a few different ways you can do this depending on your ability, depending on what's comfortable for you. It's a really important exercise to get the muscles activating low down over the kneecap and really making sure you get full range of motion through the knee. So the first version of a terminal knee extension that you can try is to have your heel elevated. Now you want to sit down on the floor, on a chair, whatever you need. You're gonna pop one foot up, the affected side up on a towel roll. I'm using a foam roller now, but you could use a rolled up towel or a cushion, as long as it's firm enough to keep the heel elevated. Now let's just assume that this is where my knee wants to rest naturally. What I'm gonna try and do is push the back of my knee downward towards the floor and squeeze the thigh muscles here at the front of my thigh, front of my knee. So then let it bend up, and then push down and squeeze the thigh muscles at the bottom of the movement. It's really important that you squeeze as tight as you can, that you don't just kind of go push down a little bit, but don't contract the muscle. We want to maximize that contraction and then let it bend, push down, relax off. So the aim is to get as much straightening as possible in the knee, as well as much squeeze in the thigh as possible. So that's the first option. Second option, which is really simple to do using a glute band, glute loop. We love the great glutes bands. You can pop this one around your feet and pull it up so that it's pretty much running across the back of your knee. Now what we're going to do here is you want to stand so that one foot is in front of the other, and then you're going to narrow your stance off. So you can see that. Can you see that there? So you narrow your stance off so that your feet are in line with each other, and you're going to lean into your front leg just a little bit. And what that does is just creates a post for the band to anchor off, and then from there with the back leg, you're just going to push back into the band resistance, squeeze the thigh again, let it bend a little bit, push back, squeeze, relax, and just repeat. So the front leg we're propping with, and you're just holding the band there with your front knee, and then pushing back into the resistance with the back knee. And again, you want to focus on squeezing the thigh at the bottom of the movement as the knee straightens all the way out. Third option, if you have it available, is you can do this with a big long band, these power bands. You can loop it around a post, loop it around a really sturdy leg of a heavy table or something, and then you do exactly what we just did with the great glutes band around the knees, but with the band looped around your rear leg, anchored off to a post. Now, these two, the first two, This one, if you're in quite a bit of discomfort, if loading it is hard, stick with this one. If the pain is minimal, but the range is a bit restricted, move to the Great Glutes version pretty quickly. Hope you enjoyed this. Be sure to check out our website, mtphealth.com.au. We've got heaps of free content there for you. We've also got online programs available, really comprehensive stuff. So check it out. If you like this, subscribe, do it. It's good for you. We hope you love it.